Much, Sean. Receding gums don't just affect older people. The American Dental Association says half of Americans between the ages of 18 and 65 already have some degree of gum recession. Take a look here. Causes include improper toothbrushing, gum disease, and even wearing braces. Tooth sensitivity and tooth loss can happen. If this is you, you may have avoided having gum grafting surgery because you believe it's too invasive and painful. Well, after years of research, dentists and inventor Dr. John Chow has developed an easier way to correct receding gums. Chow Pinhole Gum Rejuvenation is a minimally invasive technique that corrects receded gums through a tiny pinhole. As you see here, the perfect final result. Dr. Chow joins us now, as well as Dr. Ed D'Andrade, a periodontist in Vegas and Henderson, who is a provider of the Chow Pinhole Gum Rejuvenation in our area. Good morning to both of you, and
good
welcome.
Morning.
Good morning. Thank you for having us.
Now, Dr. Chow, let's start with you. Why should people care about receding gums?
As you mentioned, there are three reasons. One is hypersensitivity. When the gums receded from the teeth, roots are shown, and these roots sometimes get very sensitive. It can really impact the quality of life because some people can't even drink anything cold. That's one reason. The second reason is that loss of gum means less support for the teeth, loss of bone, and the roots get exposed that can get decayed. So if it's not taken care of, there's a possibility of losing teeth in the long run. But the strongest reason is that it is not very good looking.
Yeah.
It could be you can make a person look older when they smile with the gum line irregular and the roots exposed, and it could have a real strong quality of life factor because sometimes people don't want to smile. They lose confidence.
Right?
Yeah, they're embarrassed. They don't want to smile. They want to cover their mouth up when they smile, and it actually happens. They don't let you see it. They just look more serious than they need to be. And so, and that, when it gets done, when we correct it, instead of grafting from the roof of the mouth, we can correct it with a pinhole gum rejuvenation technique. We can very quickly, easily, and instantly correct the problem because we don't use any cutting. We don't have to stitch it. We do everything through a pinhole.
And in conventional gum grafting, there's a lot of cutting.
Yes.
Can we take a look at some of the video then that we're showing right now and describe to us what we're looking at?
This is gums being cut from the palate, on the roof of the mouth, and the flap is made on the outside, and the tissue from the roof of the mouth then is stitched to the gum where it's needed. With the pinhole gum rejuvenation technique, then we put a pinhole into the gum above the recession, and with specialized instruments that I invented, can then move the gum gently down, loosen it up, and we make it so loose that it actually drapes over the teeth in a very, very gentle way. Again, without cutting, without stitching, and this is like many other procedures in medicine, where things are done through a subterranean way, where actually you don't see, there's no cutting.
This is quite a medical breakthrough for people who want this procedure done, who were afraid in the past to smile and show their teeth and get them back to normal, healthy gums.
Yes. This is something that I believe is a breakthrough in alleviating people's fear of getting this corrected because they don't want the grafting, and the news is out about the grafting procedure causing a lot of havoc with patients and a lot of downtime problems.
Now, Dr. D'Andrade, why did you decide to offer this procedure in your clinic, in your office?
Well, fear definitely was the main reason. We have been diagnosing recession and lack of gum on patients for many, many years, and realized that patients understand that they have a problem. They realize they need to have it done for the many reasons that Dr. Chow explained earlier, but tooth loss is a problem associated with recession that progresses. So fear was my most the driving force behind me adopting this new procedure because it's very simple, painless. Patients are surprised after I'm done that it took so little time,
Yeah.
and that's really the main reason. People talk to their neighbors. They hear about taking tissue from the roof of their mouth, and they're completely paralyzed
This
and
seems
don't want to do
minimally
anything.
invasive.
Oh, absolutely.
It's actually called a huggable procedure.
A
Yeah.
huggable?
Huggable.
Oh, huggable.
We get hugs
Yeah.
now.
Oh, really?
Yeah,
That's,
Yeah, we
Wow.
get smiles. We
We
get
do
thank
surgery
yous.
like there's no surgery, and patients look at it. It's down where it belongs,
Oh, you're changing
without
their
stitching,
lives.
without any incisions on it. They actually hug us.
Oh, that
We
is,
get a lot of hugs, don't
that
we,
is
doctor?
sweet.
Yes, we do.
Is this just one visit, typically?
Oh, yeah.
That's it. So by the end of the procedure,
Less than an hour.
you could see it. Less than
Oh,
an
absolutely,
hour.
yes.
Yeah, you see that. You see it on the screen.
Okay.
You see how it's treated on
Yeah.
the left side. In one appointment is done. This is a full mouth, upper and lower. We did that one in about an hour and a half.
And these are-
immediately when you come out, it looks like that.
Typical results right here.
Typical
Absolutely.
right there. On the left
Wow.
side, this is a 9-year case.
Oh,
9 years later, it looks like that.
Wow.
And,
so there's hope for people
Yeah,
who...
this is he got married 6 months after that.
Yeah, you found somebody and got married.
He's not smiling
Right.
really big.
So somebody who's had this problem, receding gums, for 10, 20 years, you can still go and have this procedure done.
Yes. It could be very, very drastic. In one appointment, it's all down to where it belongs. Isn't that right,
Absolutely,
Dr.
absolutely.
Rodney?
We do one tooth to many teeth, just like the before and afters. We're showing several teeth on the upper and lower jaws, but it's definitely changed my practice. We are getting people from all over the state that have looked us up online, and they want to have this procedure done. As I tell people, I'm excited about it because these people were diagnosed, they know they have the problem, and now they know there's a minimally invasive way of resolving their issues.
Well, Dr. Andrade, didn't you say that you advised the patient to bring a box of Kleenex?
Yes, well, yeah.
Because they get so emotional.
That's what I say.
We
I
were
tell them-
joking. We were joking.
It's a joke, but I do tell them at the consultation, bring some Kleenex because you're going to cry when you see the results.
And they
It's
are
pretty
incredible.
life-changing.
Really quickly, let's talk about the training that you offer to the dentists.
Yes, I have trained over 850 dentists. Most of them are in U.S. and Canada, but they come from all over.
Yeah.
Last weekend we trained people from Mongolia.
Wow, all over the world.
They come from Australia, different parts of the world.
And he's
to
the only
get trained.
dentist here in town, a periodontist, that does this procedure.
Yeah, you're
I'm
the only
the
periodontist, isn't it?
only periodontist that
Yeah.
does
We
it.
have other dentists
Board-certified
in the area,
periodontist.
but it's going across the country.
Well, thank you so much.
Thank
what
you.
an eye-opener. Seeing
Yeah.
those befores and afters, incredible. Thank you
Great.
so much.
Thank you.
Such a pleasure.
Thank
to
you
be
for
here.
having
Thank
us.
you.
To find a doctor who offers the Chow Pinhole Gum Rejuvenation, visit pinholegumrejuvenation.com or call the number listed you see right there. You can also find the information on our website, vegasmorningblend.com. We'll be right back.